Thank you, everybody who's here with us for joining us today. Making a decision is always hard, especially when it comes to a device that will stay with you for years and will be an active part of your clinical or research work. And in today's webinar, I hope that we will be able to go through all the options that you can choose from and help you to choose the right one for you. We will discuss the technical specifications, advantages, and limitations of different options, and we will see some examples from the literature. And hopefully, at the end of this talk today, you will have some practical tools that will help you make this decision. So let's start. Our topics for today will be, first of all, as I said, what are the options, what we have to choose from, and then we will discuss each and every one of them. We will talk a little bit about the Qsens device and the TSA2 Air device and its potential use. As I said, we will go through technical stuff and through some examples of potential uses in research and in clinics from the literature. Then we will go to the TSA2 device and dive deep into the different options that this device has to offer and talk more about the different types of thermodes and different types of stimulation surface they have, and other technical differences, and which one should be more suitable for which application, which use. And then we will summarize and have some decision supporting tools, some questions that may guide you when you are making this decision. So this is you. The people in the crowd, I believe, are researchers or clinicians, or maybe both. Some of you are already using medical devices and maybe thinking about upgrading. Some of you maybe just considering an option to introduce QST as a small fiber assessment tool in your clinic, for example, or have some thermal testing in your research for various reasons. And the question is, what's next? What should I take into account? What should I consider when I have this decision to make now or in the future? So first of all, let's start from what are our options. Maybe you discuss it with a colleague or hear the information from our distributors, or go into our website and see these three main options for thermal testing devices. One is the Qsens, and small and portative one, and then there is the TSA2 Air, and then there is the TSA2, which lots of options, as you can see here. It has lots of arrows coming out of it, and we will now discuss briefly each and every device and its pros and cons, and what can be done with that, which is the most important part, right? So let's start from Qsens. Qsens was developed to be a simple QST device, as small, as portable, as easy to use as possible. You can see its parameters, its technical parameters on the screen. It goes from 16 degrees to 50 degrees with the rates of up to 2 degrees per second. As I said, we developed it as a standard simple QST device, so it was very important for us to keep the 30 by 30 thermode size, which we did. This device is air-cooled, meaning there is no liquid to fill. It has, you can see here, this is the Qsens Thermode. You can see here the area in which ventilators sits, and it cools the thermode down, so it's air-cooled. And being a simple QST, simple thermal QST device, we didn't want it to have anything, that you don't need. So it doesn't have synchronization tools like TTL, in and out signals. It can't go into MRI. Can't, speak with external softwares. I will cover this a bit more when we talk about TSA2. So if I talk about the advantages of Qsens, it is an air-cooled and zero maintenance device. Nothing really you need to do to use it. Just plug and play. Need to check calibration from time to time, since our devices are all calibrated, and the calibration can be checked and recalibrated if needed. But this is all the maintenance it takes. It is small and portable. It is silent. The only noise this device makes is this small ventilator here. And this is really a very, very silent device. It has the standard 30 by 30 thermode, which is required if you want to follow the standard QST protocol, qualitative sensory testing, as it was built by the German network, the FNS network that built this protocol more than 20 years ago, and collected a lot of data with that. It is suitable for doing almost the whole protocol of thermal quantitative sensory testing. It can test for cold detection threshold, for warm detection threshold, and for heat pain. It cannot go to extreme cold temperature and test for cold pain threshold. And also, some and most maybe of the people use the Qsens for the quantitative sensory testing, but there are just researchers mainly who just want to apply stimulation, just want to hurt people, you know. Just kidding. You just want to apply noxious or non-noxious thermal stimulation on different body sites and see how the patient rates it, how the subject reacts to it, etc. So this is also possible for heat tonic stimulation. As I said, extreme cold temperatures are not really an option with Qsens. So as I said, the limitations are there is no cold pain. We go only to 16 degrees, which is not painful for most of the people other than these who have allodynia, cold allodynia. It has slower rates, which, you know, you need the slow rates to perform the quantitative sensory testing battery. But if you want to go to your painful or non-painful destination faster, this might be a limitation. And it has only one thermode size. We will discuss different options and different thermode sizes, which are not relevant for Qsens. Qsens has only the 30 by 30 standard thermode, which is, I must say, one of the most popular and widely used ones. The Qsens is very widely used by clinicians, and I have here a couple of examples of papers which we know were written by our clinical users all around the world. This is our big and you know, long time clinical customer in Taiwan. They do a lot of thermal QST tests on patients every day. The device works every day, every week for the whole year. And you can see this by the number of the patients they were able to recruit for this study. More than 700 patients. And they came to very interesting conclusions here about the association between the thermal QST and the peripheral artery disease. But I wanted to focus on their clinical work and to show you how much of the patients they see and what a great work they do. And this is also a center in a complex pain center in Montreal, Canada. They use QST, both static QST, which is warm detection, cold detection, heat pain, and cold pain thresholds, and also some modalities of what we call dynamic QST. They test for conditioned pain modulation to assess the descending endogenous pain modulation pathways, and they do temporal summation to test for facilitation for another type of pain processing pathways. And they use Qsens for everything. They use it for temporal summation, then they use it for QST, and they use it also as a test stimulus in CPM. And in this paper, they demonstrated that they did retrospective analysis on clinical data collected over years, and they demonstrated that it really helped to reduce both pharmacological and interventional treatments and be more precise in assessing the treatment for children with chronic pain in this case. So, by the way, those of you who maybe are not very familiar with the terms of static QST, dynamic QST, conditioned pain modulation, etc., we have a QST webinar on our website. So if you want to learn more, it is definitely possible. You can just watch the webinar. And this device is also very widely used by researchers. And you can see here a group from Israel. They study for couple of years now. They study the brain-derived neurotrophic factor as a biomarker for neuropathy development, and they assess the small fiber functionality in neuropathic patients using the Qsens device. They do QST, and there are also researchers, as I said, that who use it for tonic heat, for tonic heat pain in this case. This group from Syracuse University, they used the Qsens on heavy drinkers, and they applied capsaicin heat model. They applied 44 degrees heat for 15 minutes combined with capsaicin bandage, and they wanted to mimic clinical pain, like acute pain, and they wanted to see its influence on the urge and intention to drink, and they showed a very nice correlation. So we discussed the Qsens device, and we are back now to our options. So the Qsens, small, simple, easy to use QST device, and a little bit more. Let's now move to the second option. This is the TSA2 Air device. We released it just last year. So it's the newest addition to our device family. And you can see that as opposed to Qsens, it is covering the full temperature range. It goes from 0 to 53 degrees for some protocols and for 50 for another. And it also has significantly higher, faster rates. It goes up to 10 degrees per second when you are heating, and up to 7 degrees per second when you are cooling. It also has a standard 30 by 30 thermode. So you can see here, same simulation area, but a little bit larger, because we have 2 fans here, not just one, to be able to cool it more effectively, and be able to actually go to 0 and working with faster rates. It does have more capabilities in terms of synchronization and working with other devices and other softwares. So you can use TTL in and out signal to synchronize between the TSA2 Air and some external device. And you can also use external control. It's a software feature that allows you to have a control to some extent of a Medoc main station software that operates the device by some external software. Sometimes you want to implement your thermal stimulation in some complex experiment in which you also show some pictures, or want the subject to perform some task, or you want to combine thermal stimulation with auditory stimulation. So sometimes you just want to control everything from some Python or MATLAB or ePrime code, and this is possible for TSA2 Air and wasn't possible for Qsens. This device cannot go into an MRI scanner and cannot work with 2 thermodes simultaneously, so these are not possible. So to summarize, it is still just like the Qsens, air-cooled and very low maintenance, small and portable device. It has faster rates as opposed to Qsens and wider temperature range, which allows you to perform full battery of QST. You can cover all 4 modalities, cold sensation, warm sensation, cold pain, and heat pain, and also perform some tonic stimulation, both for heat and for cold, including some quite extreme temperatures. Still safe to use on the skin, but you can go to 10 degrees and 5 degrees and stay there for a while. And it has this TTL and external control options for synchronization with other devices or types of stimulations. It has only 1 thermode size, and as I mentioned, this is the most popular one, most widely used one, and the standard one for performing the QST, but still something to have in mind. It doesn't have an option to work in the scanner or work with 2 thermodes simultaneously. And for those of you in the crowd who are already Medoc customers, maybe you have this device on the left on your shelf or on your cart or somewhere near you. This is the TSA device of an old generation. And if you're looking to upgrade to a newer technology, TSA2 Air can be a very nice replacement for or addition to your equipment. Since it has the same temperature range, it has the same rate, and even for heating, it's even faster than the old TSA had, and it can work with the standard 30 by 30 thermode. If this is what you need, TSA2 Air can be a very nice option for replacing your TSA of older generation. And this is just an example of something that was done with older generation of TSA. This group from Vanderbilt University tested for what is called temporal summation. In this paradigm, you apply stimulation of the same intensity, repetitive stimulation in this case, of the same intensity, and you ask the patient or the subject to rate the pain. And there are some facilitating mechanisms that cause the pain rating to go up, even though the stimulation intensity stayed the same. So this protocol was performed with the old TSA, and I just built it in our software and applied it with the TSA2 Air, and this is the result. So they used 10 stimuli with the similar intensity, went from 35 degrees to 50, stayed there for a very short time, and then went back to the baseline, stayed there, and repeated it, the same stimuli 10 times, and asked the patient to rate the pain. And you can see that this is definitely possible to do with the TSA2 Air. It is important to be quite fast in this case, because to be able to induce phasic temporal summation, you need to maintain quite high frequency. You need to stay faster than 0.3 hertz, and this is possible due to 10 degrees per second up and 7 degrees per second down that we are applying here. Okay. So in this is an example of possible use of TSA2 Air for just full battery of the QST, covering all 4 modalities. So this amazing paper was published only, I think, last year, and it was the quantitative sensor testing was performed on ATTRV amyloidosis pre-symptomatic subjects. This is hereditary condition in which patients undergo a very multidisciplinary assessment, including QST, to assess small fiber dysfunction. And the earlier you will be able to discover some impairments in pre-symptomatic subject, the earlier you will be able to start giving disease-modifying drugs. And this paper actually applies the full battery of QST and demonstrates that with thermal QST, you are able to detect impairments in a very early stage, and then this is quite important. So this is also something that was done in this paper with the TSA of an old generation, but can be definitely done with TSA2 Air, since it goes to 0 and can cover the full QST battery. So now we are back to our options, and we can see that we have the TSA2 left with all its potential possible configurations. So the TSA2 is a know-it-all and have-it-all device. It has the full temperature range. You can go from 0 to 53 degrees. It has fast rates, very fast for non-Qsens thermode. For example, for 30 by 30, you can go as fast as 13 degrees per second. And for Qsens, which we'll discuss in a few slides, you can even go as fast as 70 degrees per second. It has different types of thermodes, 30 by 30 and 16 by 16 and 6 millimeters, which we will also discuss, and Qsens. And there are thermodes that you can take into the scanner and work in fMRI environment. This device is liquid cooled, so you need to fill the liquid from time to time. I have to mention that the filling liquid process is very simple in TSA. You have very nice LEDs that show you how much of a liquid you have left, and the filling process takes really a couple of minutes. And of course, it has all the options of synchronization, the TTL, and the external control we discussed earlier, and the option to work inside the MRI scanner. By the way, regarding the external control, we also have a nice webinar on the website in our recorded webinars. So if you are interested in this synchronization and working with external software controlling your TSA2 or TSA2 Air device, you can go there and watch the webinar and learn some details. So if we discuss the advantages, as I said, it's a very flexible device, easily upgradable to any configuration, has variable thermal types and options. You can do any type of thermal testing with it. You can perform full battery of QST. You can go to heat or to cold. You can combine two thermal stimulations using the dual Thermode mode with two thermodes connected and working simultaneously. This device is DFNS recommended. And some limitations or some things that you need to take into account is, first of all, the portability. So if you compare it to Qsens, it's less portable, but it is still can be taken from place to place. It has this handle that maybe you can see here in the picture. You can just take it and from one room to the other. So it's not portable, but it's less portable than Qsens and TSA2 Air. Maybe those of you who have pathway device standing next to them will call TSA2 device portable because it's really much smaller. It is liquid cooled, so it's something to keep in mind, to fill the liquid from time to time. And I already said that the process is quite simple. And of course, this device has the highest price of all our thermal devices. So it's also something to take into account budget-wise. And again, approaching those of you who are already Medoc customers, if you have one of the three devices on the left, TSA2 can be a good option of upgrade for you. So first of all, if you are using the old generation of TSA, but not with 30 by 30, you use it with other thermodes, with 16 by 16, or with the intraoral thermode, it can be, you should consider the TSA2 since it has all these thermodes available. Those of you who have the pathway device or had this device in the past, TSA2 can do anything pathway couldn't, even a bit more. You can connect any of the thermodes you used on the pathway to the TSA2 Air. I mean, TSA2 Air, TSA2 has all these thermodes that the pathway had, and that this really allows you to test for anything you were doing with your pathway previously. And this is the Qsens CPM device we had, which was the first device out there allowing you to work with two thermodes at the same time for different purposes, stimulate two different body sites simultaneously or sequentially, and have the thermodes controlled by the same software. So this option is also possible for the TSA2, but with wider ranges and temperature range and rates, faster rates. So in a more advanced way than you had with your Qsens CPM device, if you had one. Now let's dive deeper and look at all the different options that TSA2 can offer, and what are the possible uses of these options, and which one should you go for different types of stimulation you're looking for. So we have the 30 by 30 thermode, which is the largest one. You can see here it's the same stimulation area like you had, like I showed you for Qsens and the TSA2 Air. Okay, so this is the 30 by 30, and this is the 16 by 16, which is actually half of size of the 30 by 30 thermode. And we have the 6 millimeters thermode and CHEPS, which we will discuss each one of them separately, of course. And then with some of these thermodes, you can purchase the fMRI configuration of it. You can see it has very long cable, because you need to go inside the scanner and you need this length to be able to cross the penetration panel and have the thermode inside the scanner and the device outside. And you can have two of these and work with two thermodes simultaneously. So let's start on the 30 by 30. why use the 30 by 30 with your TSA2 device? First of all, as I already mentioned, this is the most widely used thermode, and there is a lot of publications, a lot of data out there published with this thermode size, including normative data for different body sites and different areas, which you can rely on, which is quite important. And as I mentioned, this thermode size is recommended by the DFNS since it gives the most robust and sensible stimulation, and since all the data until now was collected with these or similar thermode sizes. It has the 30 by 30 thermode has large and continuous stimulation area, and this is important because when you apply your thermal stimulation on the large area of the body, you are able to achieve more robust pain or other sensation, and receive a more sensible stimulation. And this 30 by 30 thermode is the fastest one, so it can go as fast as 13 degrees per second. So if you want to perform some for example, long stimulation, you might want to go for 30 by 30 of TSA2 because it will shorten your overall paradigm time. So let's talk a little bit about the large and continuous stimulation area. Size matters in this case. There is a phenomenon called spatial summation, widely researched by Ruth Dufresne and colleagues in this, and this is just 3 examples of what they showed. So they tested how the surface of the stimulation influences the perception of heat and of cold and of sensory stimulus. And they demonstrated that the larger surface has its influence and on both thermal sensory thresholds. In this paper, they showed that the thresholds are more far from the baseline. The smaller is the thermode size, so the sensation is perceived later if you apply it on a smaller surface. And in this paper, they demonstrated that also for heat pain, it is important to apply it on, it is important to use the large and continuous stimulation area, and also for cold pain, because the pain perceived much more robust than when you are using smaller area. So this was the 30 by 30. Now let's discuss the thermode that it is in a nice place in the middle, the 16 by 16. And you can imagine, or you can look, you can see that this is really half a side of the 30 by 30 thermode. So really sensible differences between the two. And its small surface actually sometimes serves as an advantage. For example, when you want to apply the stimulation on smaller body area. For example, if you're a clinician and you have your among your pain patients, you have migraine patients, and you need to apply the stimulation on the face, you might consider working with 16 by 16, and we have pain centers in the world that have 30 by 30 for applying it on extremities, on legs and the hand, and 16 by 16 to apply it on the face of migraine patients. And you can see an example here. So disregard the contact heat evoked potential part. We'll discuss it in a couple of slides, but they used 16 by 16 to test, to perform QST on the face of migraine patients in this example. Or in an example of this group from Germany that tried to assess the influence of different types of anesthetics given in injection. So they gave maxillary injection, and they wanted to test the infraorbital region here. So they needed really to something small to be able to apply it on the face, and the 30 by 30 is too big maybe for doing so. So they were able to be very precise and perform the quantitative sensory testing on infraorbital region using the 16 by 16 thermal. Another possible reason to use 16 by 16 is if you use it on kids or children with chronic pain or with other conditions. In this example, this group is using a 16 by 16 thermode in adolescents with migraine, and this is also something, another possible reason to use the 16 by 16 thermode. So why use it? We already mentioned it. You can cover smaller body sites. You can have better resolution between the two body sites next to each other. And pediatric population, again, what are the limitations? First of all, there is no normative data available for this stimulation size, and it is a limitation, but it can be overcome, because if you are a researcher, you can maybe have your healthy control group and compare your population to these healthy controls, matching it, your patient's group. If you are a clinician, you can, in unilateral diseases, you can compare one side to the other. If it's a migraine patient, you can follow up, comparing the patient to him or herself before and after treatment over some time. So it can be useful, even though there is no normative data. And this thermode, if you compare it to the 30 by 30, it has slower rate. It can heat with 6.5 degrees per second, comparing to 13 degrees per second of the 30 by 30. So also something to consider if you need to be fast and can allow applying the stimulation on a larger area, the 30 by 30 gives you. So this is the 16 by 16. The next one is the 6 millimeter diameter thermode. You can hear it here on the, you can see it here in the picture. It was called, and some of you maybe will recognize it as an intraoral thermode. With our previous devices, this is how we called it, because it was mainly used inside the mouth or on the teeth, on the tongue. And this paper shows the use of this type of thermode on inside the mouth, on the tip of the tongue and the mucosa of the lower lip in burning mouth syndrome patients. And they did thermal and mechanical stimulation and showed that these patients have impairment in thermal processing, but not in mechanical, and it supported the hypothesis that burning mouth syndrome is a neuropathic condition. And they use this protocol, and I'm just showing it here as a standard quantitative sensory testing done in the mouth. You can, those of you who use QST can maybe mention pay attention that the baseline here is higher than we used to see. We're used to see 32 degrees as a baseline temperature, and it is true for the skin, but remember that the testing here is done inside the mouth. So the neutral temperature is not 32 anymore, it's 37 or 35. There are different papers using different baselines. Here in this case, they used 37. They repeated the cold stimulation 3 times and the warm stimulation 3 times, and asked the patient to press the button when they first feel cold and then when they first feel warm. Another reason, and you know, it's maybe laid a little bit outside of our regular uses of medical devices, there is a phenomenon called thermal taster status. There are people out there that when you heat or cool their tongue, they perceive some taste stimulation as a result of this cooling or heating. So some feel it as sweet, some feel it as bitter, some even feel some more exotic taste like metallic or acid. So this is just an example of paper testing this these people with the disability. They did a warming trial, so they pre-cooled the tongue and then warmed it, and they did the cooling trial, and they asked the subjects if they perceived any taste stimulation and they or taste feeling sensation, and you can see that they reported some different types taste, and it's quite an interesting phenomenon, both for from neurological point of view, but also for food industry. And those of you who are maybe researching in this area might be interested in this potential application. And these are just two examples. Actually, you can do more than that. There are people out there who are using intraoral for genital testing, be it on a penis for a male, or on clitoris, or another genital area for women. And there are just people who are using, and researchers who are using this thermode just to apply stimulation in very small stimulation area. For example, on the ear or on the eye outside here. If you just need to apply thermal stimulation on very small body area, this might be a good and interesting option for you. Okay, so now the next in our list is a Qsens thermode that allows you to go faster. It has rapid rates. You can go heat with the 70 degrees per second rate and cool with 40 degrees per second rate. And you have the full temperature range with TSA2. Those of you who maybe remember the use of Qsens with previous devices, with pathway, you couldn't go to 0. Now you can with the TSA2. And it has large and continuous stimulation area. It is 24 by 24 millimeters, large and nice to apply robust and sensible stimulation. Why would you want to use Qsens? And there are several reasons. The three main of them are, first of all, evoked potentials recordings. You can apply rapid and painful stimulation for heat, or non-painful even for cold, and record how the the brain reacts to it with the EEG, and you will receive something like that, some evoked potential in the EEG with the N2 and P2 amplitudes, and you can measure the latency, meaning the time that passed from giving the stimuli until receiving this reply on the EEG data. And you can measure the amplitude, and you can compare the person to him or herself. You can compare ill population to healthy control, and this really gives you some objective tool to assess the pain pathway from the skin to the brain, let's call it. And then there is phasic temporal summation that I already mentioned today. And you can imagine that given the fact that you need to maintain high frequency, it can be much easier to do using the Qsens thermode with 70 degrees per second up and 40 degrees per second down than using standard, more slower, thermodes. You don't need to have higher baseline. You can start from the 32 neutral baseline and still be fast enough using the rapid rates. And you can have other reasons you want to get there faster. Maybe you have limited time for your paradigm and it is already long enough, and you want to shorten it by minimizing the ramping up and the going down time of your noxious and non-noxious stimuli. So let's look at some examples. This isn't just one recent example of the use of evoked potentials recording with the Qsens thermode. So in this case, this group from China wanted to assess the exercise-induced hypoalgesia, and they looked at the N2P2 amplitude, and they demonstrated the reduction of it by the exercise-induced hypoalgesia. So just in addition to just subjective pain reporting, they saw it also on the amplitude recorded by EEG. And this is an example of using Qsens thermode for phasic temporal summation. They wanted to show the association, this group from Stanford wanted to show the association between the temporal summation and conditioned pain modulation, two dynamic QST tests, and the temporal summation was done using 10 stimuli applied with the Qsens thermode. Now let's move to another section and possible application you might be interested in using the device and the thermals in the scanner in fMRI. So the thermal that can be used in fMRI are the TSA2 30 by 30, 16 by 16, and CHEPS. And I start from CHEPS because getting there faster is very relevant when you work in MRI. You have limited scanner time. You don't want to keep your subject inside the scanner for longer than needed, and therefore many consider and use the CHEPS Thermode with its rapid rates inside the scanner. In this case, the thermal heat stimulation was applied on the trigeminal area of healthy controls, migraine with and without aura, and they demonstrated the differences between migraine patients with aura versus other two groups, and really could show the patterns in cortical regions while applying thermal stimulation. And then there are examples of two other options of thermal that you can use inside the MRI scanner. 30 by 30 was used in this paper on older healthy subjects to see how the age influences the pain perception and sensory perception, how it is showed inside on the fMRI scan. And in this paper here, actually very new one, published by a group that are a long-time customer. They are using the 16 by 16 thermals inside the scanner for quite long. And in this case, they wanted to see how doctor truthworthiness influenced the pain and the neural correlates while patient subjects in the scanner were having virtual interaction with doctors, either more truthworthy or less, and they showed that it actually influenced their pain perception, both subjective and also how it is seen in the fMRI scan. Another option the TSA2 can offer you, and this is the last one, bear with me, is the work with dual thermode, with two thermodes simultaneously. You may want to do so for different reasons. You can want to you may want to just stimulate first right hand and then the left hand without the need to switch the thermode. And you can also, and this is the main reason people asked us, and our customers asked us for dual thermode mode, is to use it for what is called conditioned pain modulation test that allows you to assess the inhibitory pathways, and the phenomenon of pain inhibits pain. So you apply test stimulus on one body side, you ask the patient or subject to rate it, and then you apply the same test stimulus in combination with another painful stimulus, the conditioning stimulus, and you ask to rate the test stimulus again, and you see that there is a reduction in the pain perceived by the test stimulus, which is actually, this delta is the CPM effect. It reflects the inhibitory pathways. So in this case, our previous dual thermal device, Qsens CPM device, was used in adolescents with non-suicidal self-injury, and they wanted to see how the pain processing maybe is different there, and they demonstrated in deficit in endogenous pain modulation as reflected by CPM. They did test stimulus first, they repeated it twice and asked for pain rating. Then they started the conditioning stimulus and applied the test stimulus again. And if there was a reduction, it means that in pain rating, it means that the CPM is efficient. And if there was no reduction or even some facilitation, it means then that the CPM is impaired and there is some impairment in the endogenous pain modulation mechanism. Another example, and this is also a very, very nice paper demonstrating actually the whole protocol for standard and dynamic QST. They aimed for more brief protocol, allowing to have all these tests implemented in research and clinic with less time needed to do so. And they assessed the test-retest of this protocol, and they used their Qsens CPM device for QST, for temporal summation, and for CPM. So they had this paradigm a bit different from a previous example. They had this test stimulus going on and asking patient or subject to rate it, and then they introduced the conditioning stimulus, and during that they rated they rated the test stimulus again, and looked for a reduction in pain rating. So this was possible to do with dual Thermode configuration, and is possible to do with the new TSA, of course, and the two Thermode connected to it. Just something to mention, that you can connect two 30 by 30 or 16 by 16 or even intraoral 6 millimeter diameter thermodes. You cannot connect two Qsens thermodes simultaneously. So it's something to keep in mind when you consider and think about what you're going to go for. And again, for CPM, the larger the stimulation surface, the more robust will be the effect. So 30 by 30 should be definitely considered. So now we summarize, and here you have all the technical details of and technical parameters of the three devices. You have the comparison of their temperature range and the rate and possible thermodes. We already discussed the availability of Qsens and fMRI and the dual Thermode and external control and TTL in and out, and the modalities these devices cover. So it's really stuff that we already discussed, just put together in one table, so you could compare and see the difference between the three options you have to choose from. And then this is a decision supporting tool that we built based on questions we got asked by potential or existing customers, and some guiding questions that can help you to make a decision. So first of all, you need to think about the potential use of the device, and not just for the current study or current work. Maybe now you just need the 30 by 30 and that's it, but you need to ask yourself, will I need at any point to add another Thermode and perform CPM? Would I want to do maybe some work in the scanner later, or maybe have a Qsens Thermode with higher speed for different types of stimulation? And if the answer is no, I definitely need only the 30 by 30, then you can continue here. But if the answer is yes, you definitely should consider the TSA2, because this device is easily upgradable to any of the above configurations. And even if you purchase it in the first place with just 30 by 30 or just 16 by 16, you can add accessories, add thermodes, and work with any of the mentioned configurations in the future. But if you're definitely 100% know that you just want the standard thermo, the standard uses, not non-fMRI, Qsens, dual Thermode, just one Thermode, you need to ask yourself, do I need the 30 by 30 or no? If you need anything other than 30 by 30, 16 by 16, or intraoral, then you again should go for TSA2 that allows you to use different Thermodes. If you are 100% sure that all that you need is the standard 30 by 30, I just want to perform QST, that this is what I need, so we can move here. And then the next question is the cold pain important for me? If I am a neurologist and I just want to do warm sensation and cold sensation, cold pain is not very significant, might be not very significant for me, and I can live without it. If I want to do the full battery of QST, then yes, I need the cold pain. So if I need the cold pain, I can select from TSA2 or TSA2 Air, because Qsens doesn't give me that option. But if I don't need the cold pane, the last question is how fast would I want to go? If I just want the simple QST, I need 1 degree per second, that's all that I need, then the Qsens will definitely answer your need. But if you need faster rates for any reason, you want to perform heat temporal summation, and 2 degrees per second is not fast enough for you, then you again can consider both TSA2 and TSA2 Air. So these are just some guiding questions that I think can help you in deciding which way is the right one for you to go. And with that, I would like to finish and thank you all for joining. My presentation is not cooperating with me, unfortunately. So I would like to thank you for joining and encourage you to approach us via info email or website inquiry, or any way you like, just to let us know if you have any questions or need some additional information. We will be happy to help with that. So now we will have a little bit time for questions. I will stop sharing my screen, and those of you who maybe I will not have enough time to answer all the questions, I will be happy to get back to you later. So there's a question: can I perform temporal summation with the intraoral or 16 by 16 thermode? So that's a good question. If you are looking for phasic temporal summation, that might not be that good of an idea, because you want, first of all, you want the, of course, the larger stimulation surface, but mainly you want it to be as fast as possible. And I mentioned that the 16 by 16 and also intraoral are slower, and they cannot go as fast as 10 degrees per second or 13 degrees per second. So you won't be able to perform phasic temporal summation, or at least it will be very challenging. There is an option to perform a static temporal summation, tonic temporal summation, in which you apply tonic painful stimulation of the same intensity, and you ask the patient to rate the pain, and you can see some facilitation even though the stimulus stays exactly the same. I would again recommend to go for 30 by 30, because then you have larger surface and more robust and more painful stimulation. But if you are looking for applying thermal stimulation on the face, for example, maybe 16 by 16 could be an option for tonic temporal summation. Okay, I don't see additional questions. If any of you will have questions at a later stage, please feel free to approach us, and we'll be happy to help. I would like to encourage you to feel the feedback you will receive right after we finish this webinar. We would really love to know how we did, which topics can be interesting for you for next webinars, and what would we do better. And I hope that this was helpful for you, and hope to see you in our next webinars. Thank you very much.